Now, as we promised you at the start of the bulletin, we have a special report, a message that was given by the first Sri Lankan who contracted the COVID-19 virus and also successfully recovered from this virus. He spoke exclusively to Sirasa FM. These are the views that he expressed.
I
am Jayanta Ranasinghe, the first person in Sri Lanka to be infected by COVID-19. I completely recovered from this infection and I'm now at home. I thought of giving this message. I know that I have completely recovered from this virus. I managed to save the members of my family. The reason I was able to save them was because when I started getting a fever, I went and met the doctor in my village and I took action based on the advice of my doctor. I did not get intimidated or scared and I did not hide. I was directed to get myself admitted at the IDH hospital. Because I thought about the future and acted on this medical advice, I was able to save my children and my entire village of Mattegoda. I am a person who walks around a lot. So if I stayed at home for even one day after I got infected, I would have gone to the pharmacy, the shops in the village, and this virus would have spread among the people. So therefore, my message to you is, don't hide and don't be afraid. If you have the symptoms of this viral infection, come forward and reveal these details. If you do, you will be able to save not only your children and your family, but your entire village as well. I have fulfilled my responsibility. You too should fulfill your responsibility. Protect your village and protect your country. Now, speaking about the current situation of the COVID-19 outbreak here in Sri Lanka, according to a report issued by the Ministry of Health, the total number of patients who recovered after being infected by COVID-19 now stands at 22. 250 people who are suspected to have contracted the coronavirus are currently under medical observation. Now, the number of COVID-19 related deaths here in Sri Lanka currently stands at 4. A number of villagers continue to be under isolation due to the pandemic. The villagers under isolation are Telambugahavatta in Akurana in the Kandy district, the Atulugama village in the Kaluthara district, Kudumayan Kulam in the Putlam district, and Tavidi village in the Jaffna district. All entry points to the Atulugama village have been closed down and the area has been isolated. 24 coronavirus patients have been identified in the Kaluthara district. Also, 1,260 people have been quarantined in their homes. 22 people from the Atulugama village and 219 people from Beruwala have been taken to quarantine centres.
නමදෙනෙකු මෙවන විට නිරෝධායන මධ්‍යස්ථානවල නිරෝධායන කටයුතු සඳහා ලක් කරලා තියෙනවා. පවතින තත්ත්වය යටතේ
The OIC of the Katugastota police launched a program today to provide food to stray dogs that are roaming in the area and have been starving. Youth in Kahalla Katugastota served king coconut to the police and army personnel on duty in the area as a gesture of goodwill.
කටුගස්තොට කහල්ල ප්‍රදේශයේ තරුණ පිරිසක් එක්ව
Now, speaking more about the current situation of the COVID-19 outbreak here in Sri Lanka, you heard the views that were expressed by the first Sri Lankan who contracted the virus and also the first person to recover here in Sri Lanka from the COVID-19 outbreak. Now, this patient was first detected on the 11th of March. That's the first patient in Sri Lanka was detected on the 11th of March, and since then, according to the graph that you can see, the COVID-19 virus has been reported from many districts across the country. Now, this is a chart that clearly depicts the projection of the number of COVID-19 cases that were reported here in Sri Lanka throughout the course of last month since the virus was first detected in Sri Lanka, which was on the 11th of March. Currently, the number stands at 151. However, by this evening, the IDH hospital had updated their website, and the number of corona patients who have currently been identified here in Sri Lanka, according to the IDH website, stands now at 152. Now, where do these patients come from, and where are the areas that these patients were reported from? Now, as you can clearly see here in this this graphic representation, 36 patients have been reported from the Colombo district, and in the Putlam district 35 patients have been reported. In the Kaluthara district there have been 24 cases of confirmed COVID-19 infections. In the Gampaha district that number stands at 11. In the Kandy district there are 4 patients. The Ratnapura district there are 3 confirmed COVID-19 infections. In the Kurunegala district there are 2. In the Gaul district 1. K-Gaul district 1. The Batiklo, Badul districts also have reported 1 case each in those districts. And in the Jaffna district, there have been 4 confirmed COVID-19 patients that have been reported from the Jaffna district, while in the Mathura district, again, the number of confirmed COVID-19 cases stands at 1. Now, there have been 34 quarantine centers set up across the island, while people have also been advised to self-isolate, and there are many people who have been placed under mandatory quarantine in their homes, in their own homes, in addition to these 34 quarantine centers that have been set up in the country. And once again, the total number of confirmed COVID-19 patients here in Sri Lanka stands at 152. And it must also be mentioned that 24 patients have currently completely recovered from the COVID-19 virus. Now, with the government imposing curfew across Sri Lanka and bringing in strict regulations on the mobility of the people here in Sri Lanka, according to information that we have received through Google, the mobility of people here in Sri Lanka have been tested, and they have reported an 86% drop in people visiting under the category of retail and recreation. Now, those are mobility trends for places like restaurants, cafes, shopping centers, theme parks, museums, libraries, and movie centers. Moving on to the next category under grocery and pharmacy. Now, these are people who visit stores, shops, supermarkets to purchase their groceries, and also pharmacies, of course, to purchase their medicine. According to data that has been received by Google, there has been an 87% drop in the mobility trends for places like groceries, markets, food warehouses, and especially food stops and drugstores and pharmacies. People visiting parks has reduced by 57%. Moving on, people visiting transit stations, of course, with the imposition of curfew, people were encouraged to work from home, but certain people did go to work for essential services. However, the number of people visiting transit stations such as public transport hubs, subways, bus stations and train stations have reduced by 78%. People visiting workplaces has reduced by 50%. And the final statistics is the number of people who remain in their residences, and this number has increased by 32%. Now, these are data that has been collected by Google, and these are the trends or the mobility trends for various places here in Sri Lanka and how they have varied with the imposition of curfew and the current COVID-19 outbreak here in Sri Lanka. Now, of course, during